This segment of Delmarva Life is brought to you by Peninsula Home Care.
Well, most of us probably know someone who has battled breast cancer. Maybe you are.
This year alone, the American Cancer Society estimates that doctors will diagnose more than 232,000 women with invasive breast cancer and more than 2,300 cases in men. The Society reports there are nearly 3 million breast cancer survivors in the United States.
And most people who have breast cancer opt for surgery. A couple of the most common types of surgery are the mastectomy and lumpectomy. But once a surgery is finished and breast cancer patients are on their way to recovery, there's another condition that may develop.
It's called lymphedema. Basically, fluid builds up in the arm after the lymph nodes have been removed. The condition can restrict your motion. It can cause painful swelling that actually can be very noticeable. But you don't have to go through the pain. It's important to know that there is treatment available for lymphedema.
Joining us today to tell us more are Peninsula Home Care Community Liaison Therese Ganster and PHC Certified Lymphedema Therapist Allison Hain. Thanks for joining us this afternoon. So can something like cancer treatment actually cause lymphedema?
Yes. Cancer treatments consist of a removal of lymph nodes or assessment of lymph nodes. Radiation can occur also to those lymph nodes, and your lymph nodes are kind of like your garbage cans. They collect all your bacteria, and so if those lymph nodes are removed, you can have a backup of swelling in your arms and legs.
Okay.
Is there something that we might know that it's starting to develop?
Yes, if your clothes become tight along your sleeve line, your jewelry becomes tight, rings, bracelets, lack of range of motion, you can't move your arm as well, you have pain,
Right.
You have changes in your skin texture,
Right.
and changes in skin color.
And Therese, occupational therapists can help with the treatment of lymphedema. Now, this is different from physical therapists, right?
Absolutely. Although physical therapists can also be certified in lymphedema if they choose to, the difference between occupational therapy and physical therapy is that physical therapy has a tendency to want to help with strengthening and mobility. The occupational therapists are the unsung heroes. They're the ones who actually go in and work with the person to adapt themselves or the environment so that they can get back to their own maximum independence and things that they love to do.
Right.
Okay, so now let me make sure that I got this right, Allison. You've got occupational therapists, and they can be lymphedema certified.
Yes.
For training, for therapy there, to help out those patients.
Yeah, the certification consists of therapists who want to extend their education in swelling management. And there's different techniques with compression bandaging, massage techniques, kinesiotaping, and we learn all of this. And so we can effectively treat the patient with lymphedema because there is no cure. And so it's a lifelong management that we need to train the patient to be able to manage.
Okay, so as a certified lymphedema therapist, can you show us how you would treat a patient?
Yes, after an assessment, when we do massage techniques, one thing we do is compression bandaging. And for an arm that was affected, what we would do is start right at the wrist.
Okay.
And it's multiple layers. And how we do this is just with this bandage, we just wrap it on the arm. And we go through the hand. Sometimes the fingers are affected, sometimes they're not. So if the fingers are swollen, we would have to wrap them as well with a different type of bandage.
It looks like an ACE bandage.
It does. It's a short stretch though. ACE bandage is really stretchy. This is, there's not much pull to it.
Okay.
And you can tell it's not very tight, and we just wrap up the arm. And when we end at the top, we always start from the base to the top.
Right.
And there's 3 to 4 layers depending on the amount of swelling that you have, but you are able to move and be functional in
So
it.
how long would I have to wear this?
During the treatment, we like 24 hours of compression, and depending on the symptoms and how much edema or swelling you have, depends on how long you'd have to wear this. But most times it's a couple weeks of constant 24-hour compression, and then again we teach you how to manage it with compression sleeves that are not as noticeable as these bandages.
And again, this is just a treatment. There's no cure for lymphedema.
There is no cure. So early detection is key, and you want to go and if you have the symptoms that we talked about, talk to your doctor about what you can do to help.
Is this kind of a treatment just for cancer patients?
No, no. Other diagnoses can be chronic venous insufficiency, which you have a lot of swelling in your legs.
Oh, okay.
The compression as well can help that. As long as all your internal organs are okay and you can follow up with a doctor and they approve of that, we can do the same treatment.
If I'm a cancer patient, are there things I can do to prevent the lymphedema?
To prevent the lymphedema, you want to make sure that you keep your skin nice and moist. Lotion is always a key. You don't want to use a lot of perfumes because it dries out your skin. Staying out of the sun, because sunburns can actually increase that swelling in your body. And bug bites can cause a little infection. It can cause the start of a swelling in an area. And manicures.
Really?
Manicures can cause it as well, because if you get nicked, you can get an infection through your hand.
How
Oh
about
my
that?
goodness.
But
Okay,
I-
now, let me make sure that I understand this right. There's no cure for lymphedema, but you can prevent it, and that's important as far as early detection.
Yes. So as Allison was talking, any form of swelling
Right.
that you would notice, if your hands are swelling with your rings, your wristwatch is getting a little bit too tight.
Pay attention.
Yes.
Pay attention.
Your skin is maybe turning a little bit discoloration because it
Check
is
it out.
swelling a little bit more.
Ask your doctor to find out.
Absolutely.
Teresa, Allison,
Teresa,
thank
Allison,
you.
thank you so much. And if you would like to know more about Peninsula Home Care, go to delmarvalife.com and click on the show tab.
Coming up next on Delmarva Life, are you crazy? What the experts have to say about your inability to focus on random thoughts that cross your mind maybe, and whether or not it's anything that you need to worry about.
And from mental health to healthy eating, trying to figure out what's good for you is enough to drive you crazy. Today we simplify it, the 8 foods that will get you on the right track, and guess what? One of them is chocolate.
Oh yeah. Dr. Oz also wants to see you eat smart, especially in this warmer weather. And with all the get-togethers he's got coming up, he's got some advice to help.
From Memorial Day through Labor Day, summer means non-stop celebrations. Here's how to eat smart and still indulge in the foods that you love. 1. Grilling is great. The healthiest choices are chicken, lamb, or fish. A great tip is to marinate it beforehand for a few minutes to reduce the risks of creating carcinogens if you're charcoaling. 2. Bag the chips in the dip, just get rid of them. Instead, serve up cut-up veggies and hummus. They're high in protein and fiber. 3. Have a glass of red wine. It's high in anti-aging resveratrol. And of course, drink moderately. Lastly, there's nothing like eating outdoors, but you have to practice food safety. Don't leave perishable food out in the hot sun, which can breed salmonella and other dangerous bacteria.